Your submission says not detected, the method passed validation, every box ticked, and the FDA still sends back a deficiency letter because the confirmatory test couldn't actually see the nitrosamine it claimed to rule out. That one gap sits behind a striking share of rejected submissions. Hello, I'm Raghuveer Singh Parmar, Director Scientific Affairs at Resolve Mass Laboratories, and we worked with pharma and biotech teams to build nitrosamine methods that survive regulatory review. Today we are unpacking what confirmatory testing really has to prove and why FDA keeps rejecting the packages that get it wrong. Let me show you how a clean result still fails. A team runs a nitrosamine test, gets a not detected, and files it as a proof of safety. On review, FDA asked one question, not detected down to what level? The method's quantification limit set above the acceptable intake limit. So not detected rule out nothing, and this isn't rare. Since the 2018 Sartan recalls, the bar has climbed. Published methods in 2020, compound-specific NDSRI limits in 2023, and a fully revised FDA guidance in 2024. Each step raised what a submission has to prove. So what does the FDA expect? The approach runs in 3 steps. 1. A risk assessment. Could a nitrosamine form here from the process, the structure, or the packaging? 2. If yes, confirmatory testing. Go to the bench and measure with a method sensitive and specific enough to trust. 3. Report and control what you find. Confirmatory testing is the middle step, and it carries the weight of the whole exercise. A risk assessment only flags what's possible. Confirmatory testing proves what's actually there. That's exactly where submissions fail apart. Screening and confirmatory testing are not the same thing, and confusing them is a classic way to earn a deficiency. A screening method is built for speed and breadth. Cast a wide net, flag anything suspicious across many samples. It's a filter, not a verdict. A confirmatory method is built for proof. It quantifies one nitrosamine accurately at or below the acceptable intake limit and confirms the molecule identity. The failure pattern is submitting screening grade data, a fast generic method with a limit set too high, and calling it confirmation. Reviewers catch it immediately. Here are the 3 reasons confirmatory testing gets rejected most often. First, it isn't sensitive enough. The quantitation limit sits at or above the acceptable intake limit, so not detected proves nothing. Second, it isn't specific enough. One mass transition flags a peak, but nothing confirms that the peak is the nitrosamine and not an interference, which invites false positive. Third, it isn't a complete. The method catches the obvious small nitrosamines but misses the NDSRI. The drug's own structure can form. Sensitivity, specificity, and completeness. Miss one and a validated method still can't answer the reviewer's question. So let's make sensitive enough bit more concrete. NDMA carries an acceptable intake of 96 nanograms per day, NDEA just 26.5, and for many NDSRIs, the carcinogenic potency categorization approach pushes limit below 20. Your quantitation limit has to set well under whichever number applies. A common expectation is quantifying at or below 30% of it. If this is helping you pressure test your own methods, a quick like helps other analytical teams find it. Here is the trap. A method perfectly sensitive for NDMA can be nowhere near sensitive enough for an NDSRI, and reviewers check that match every time. 3 real cases show how this goes wrong. Ranitidine Zantac is the cautionary tale. A hot GC inlet generated NDMA inside the instrument, inflating results until the FDA moved to an LC method. The sartans went the other way. For volatile NDMA, the GCMS headspace method was genuinely confirmatory. Then the NDSRI wave hit where reference standards barely existed and identity had to be confirmed by high resolution mass, not just a single transition. At resolve mass, we have seen submissions bounce for exactly these reasons. A limit set above the intake limit or positive, that was really the method confirming the analyte. The chemistry differs, the review question never does. So how do you build a confirmatory package that passes? 5 moves. 1. Scope the analytes, list every nitrosamine the product can form, parent type and NDSRI so nothing is missed. 2. Choose a method that confirms identity, not just detects, usually LC-MS with 2 transitions or high resolution MS. 3. Validate at the limit following ICH-M7 and Q2, accuracy, specificity, recovery and an LOQ below the acceptable intake. 4. Confirm identity explicitly with ion ratios or accurate mass. 5. Report against the limit. Do this in order, and not detected finally means something a reviewer can accept. So what should you walk away with today's discussion? Confirmatory testing has to prove identity and quantity at the limit, not above it. Screening data is not confirmation. Sensitivity, specificity and completeness are what reviewers check. And not detected only counts when your method could actually have detected it. If you are working on an IND and ANDA or a marketed product and you want a CRO partner who treats confirmatory testing as where a submission is won or lost, Resolve Mass Laboratories supports small and mid-sized teams from pharma and biotech from risk assessment through validated submission-ready methods. If this helps you, send data a reviewer can trust, and likes tell me keeps going. Subscribe this video channel so this kind of videos can come up to you, and it helps us to create more and more informative videos. Thank you so much for watching this session, and see you in the next one. Until then, goodbye for now.